Welcome to Munroe Regional Medical Center's nationally recognized and awarded Munroe Heart program. At Munroe Regional, we provide a patient-centered team approach, and you, the patient, are the most important member of the team. This video will help you and your loved ones to better understand and what to expect before, during, and after your surgery.
You are scheduled for a carotid endarterectomy. The intention of this surgery is to potentially reduce the risk of a stroke. For this operation, an incision is made in the neck. Then the carotid artery is opened and the plaque is removed. A pericardial patch is used to close the opening. Sometimes a drain is left in the wound and removed the following morning. An average time for this surgery is 1 hour. Prior to surgery, you will be met with an anesthesiologist who will review your medical history as it pertains to anesthesia. The anesthesiologist will also discuss with you various methods of post-operative pain control and review your medications. You will also be scheduled for pre-operative testing and education. Your pre-operative testing will include blood work, EKG, chest x-ray, urinalysis, and nasal swab to screen for MRSA. MRSA is a type of staph bacteria that people can harbor in their nose without having any ill effects. But if it becomes more active in your body or incision after surgery, it is more difficult to treat. For this reason, we are being proactive in screening for these bacteria. If your nasal screening comes back positive, you will be treated with an antibacterial ointment in your nose for 3 days. Surgery may be delayed for this treatment. You will receive instruction on how to shower before your surgery using a special antimicrobial cleanser and where to purchase the special cleanser. Showering several times before surgery with the cleanser helps reduce the risk of infection by decreasing the surface bacteria on your skin. First, pour the liquid cleanser directly on your hand rather than a washcloth. Then apply it to your body from your chin down to your toes. Let it stay on your body for 2 minutes and then rinse off thoroughly. Do not use this cleanser on your face or your hair. For those areas, use your normal soap and shampoo. Do not apply anything to your skin afterwards, such as lotions, powders, colognes, or aftershave products. When you come to Munroe for your surgery, we ask that you leave all valuables at home. You will not be allowed to eat or drink anything after midnight, including gum, mints, and water. No makeup, jewelry, or nail polish is to be worn, and do not bring any medications with you to the hospital. You will be given the hospital gowns to wear. Please bring your own toiletries and a pair of non-skid footies. We are often asked about our surgery schedule. The operative schedule is not made out until the evening before surgery. Even if your surgery is not the first one scheduled, you will still be asked to arrive early at the hospital since the surgical schedule can be unpredictable. You may want to bring a book or something that helps relax you until you are taken to the pre-operative holding area, where an IV will be placed, hairs around the surgical site will be clipped, and medications to relax you are given. One person may stay with you in this area until you are taken to the operating room. Your family member will be escorted to the surgical waiting room once you are taken into surgery. After surgery is complete, your surgeon will speak with your family in the surgical waiting room. Please ask your family members to bring a sweater since the waiting room can be cool. It may be up to 2 hours after surgery before your family can visit with you. Once visitation is allowed, a nurse will escort your family from the waiting room to your bedside in cardiovascular intensive care. Visitation is limited in the cardiovascular intensive care unit or CVICU to 2 people at a time. The nurse will guide you on the frequency and duration of visitation. Each visit will usually be 10 to 15 minutes. Cell phones, food or drink, children under the age of 12, and overnight visits are not permitted. Fruit baskets and flowers are not allowed. You will stay in the intensive care unit for a minimum of 1 night. Your family will need to have your PIN number available when calling the hospital for information regarding your recovery. This number will have been provided to you in advance of surgery. The PIN number is meant to be given to just one person who will serve as the family spokesperson. That spokesperson can then pass that information on to other family and friends. This helps control the privacy of your health information and allows the nurse to remain focused on your bedside care. At the importance of minimizing the risk of infections, We ask that all of our visitors help by utilizing the hand sanitizers located in the hallways and each room. Please use these sanitizers upon entering and leaving during your visitations. Some of the tubes you may have include a special IV in your neck, an arterial line in your wrist to monitor your blood pressure, and a Foley catheter that drains your urine. You may have a drain in your incision that would be removed the following day. Your nurse will be able to give you a small amount of ice chips to help with the dryness. While recovering from this type of surgery, the nurses will assess your neurological status in part by asking you to perform various tasks such as wiggling your feet, squeeze their hands, raise your arms, move your tongue side to side, smile, or other movements. Questions will also be asked to assess your orientation to time, person, and place. You can plan for an overnight stay in the cardiovascular intensive care unit. Typically, you will be discharged the following morning directly from the unit, usually between 8 o'clock and 10 o'clock a.m. We want you to be a well-informed and well-educated patient. Please be sure to ask questions and understand all that is being done for you. Before you are discharged, know any new medications, what they are for, and their side effects. There will be no driving post-operatively for approximately 1 week. You'll be limited from any vigorous activities such as golfing, tennis, swimming, or mowing the lawn. You will have a post-operative appointment in approximately 1 to 2 weeks, at which time your doctor will advise you further. We will want you to shower daily as instructed and increase your activity as tolerated. Now is a good time to think about your lifestyle and look at ways to make it healthier.
Here at Munroe Heart, you will be in the hands of a very competent cardiovascular team. We all care about helping you and your family through this entire surgical process and hospitalization. Thank you for choosing Munroe Regional Medical Center.